the stage. So we have Kevin and Jana, who are the who is the rapporteur of Group 2, rapporteur of Group 3, Andy. Andy is Group 3, I assume? Yes. So we're only missing Group 2. Who's the rapporteur for Group 2? Roma children. Who is representing the Roma children group? They're here? They're not coming? So we'll wait. Nobody from that group is here? Okay. Sarah, are you reporting on behalf of the Roma group? No, that's Liana. Okay.
Is this on? Okay. I'm just going to make a quick announcement. If you look on the screen, I don't know his name. Can you click on the link, that first link? I just wanted to announce that today our WIB for the workshop that we had in Addis Ababa in July was released, and if in just a second the link's going to come up, so you can go to our website, our activity page, and download this. I was reminded of it because we were talking about parents and investing in families in our particular breakout group, and that's what this workshop really dealt with. So feel free to download this. It's hot off the press today.
Okay, so I think we can start. We have all the rapporteurs, so I assume all the participants of the breakout groups are in the room. The rapporteurs, you all have about 5 to 6 minutes to report back on the summary of your group. And let us start with Kevin, who will report on behalf of Breakout 1, Children Living Outside Family Care.
The group began by looking at a film from the Lumos organization, which you can view yourselves on wearelumos.org. And the film has been produced by J.K. Rowling and has her narrating basically a 3-minute summary of what we know about the harm to young children that institutional care can do, and how it's a choice, not a necessity. And also the very important message is that the harm done by institutional care or extremely bad biological parent care or extremely bad foster care or adoptive care is preventable if you move the child out of those environments, and of course it's irreversible that in good quality family-based care the damage to even the neural networks of the brain can be recovered. So with that optimism, the film ends, and it's very well done, and I'd recommend that you have a look at it. It talked about poverty and family breakdown and the relationship between how some parents don't have a choice in putting their child into an institutional environment because of the situation that they find themselves in terms of poverty and migration for work. Then we looked at, it also quotes that only between 80 and 96% of children in institutions have one living parent, and so that for the majority of them there is another choice. We then went on to listen to Dr. Ibova from Bulgaria, and she spoke about the Karen Dom Foundation and a UNICEF project which specifically looked at the advice given to parents who have a disabled child at birth. And she said there are two main influences. There are the relatives that may influence the decision about whether that parent keeps the child or not because of the disability, and then there are the doctors and nurses. And alarmingly, she said that 30% of the time, the doctors and nurses are telling the parent to put the disabled child in an institution. So that's 1/3 of the time, nearly. So there was a project where psychologists were placed in hospitals in Bulgaria to support the doctors and nurses in a number of ways. One, to support their feelings around delivering and dealing with disabled children, and two, talking about alternatives to children being placed in institutional care. And that was alongside social workers working in maternity units to prevent the mother abandoning the child. So that was a very good example of how one can reduce the input into institutional care by stopping abandonment. Another example of stopping the input into institutional care was given by talking about the gatekeeping mechanism that's possible, and a good example of that is in Moldova, where before a child is placed anywhere, there's a committee or a case conference around that child and that child's needs, and only when that committee or case conference is convinced that the placement, whether it be in foster care, kinship care, or an institution, if it's in the best interest of the child, then that's where the placement would be. And that gatekeeping mechanism that's been in place in Moldova for a number of years now has prevented a number of children going into institutional care and being diverted to foster care. They also confirmed in Moldova the value of social workers in maternity units, and said that they managed to reduce abandonment from maternity units from 62% to 21% of cases. We then went on to look at foster care in a bit more detail, and that's how the meeting finished. We had a film from Romania, a 30-second advert to promote foster care and adoption, and it was produced by Saatchi and Saatchi for the Romanian government and the European Commission, and emphasized that children are more concerned with having parents and a home than they are with clothes and food, and concluded that a children's home is not a home. And that was basically the message of the advert to promote foster care. And then we looked at foster care in some detail, talked about good quality foster care and how to promote that foster carers need training, they need support, and sometimes they can even have diversification into different types of foster care. Short-term foster care, which can be therapeutic and be a role model to parents with the idea of putting the child back with the parent, or long-term foster care, which is where the child lives to 18, emergency foster care, etc. So with that, we then quickly looked at the comparison between institutional care and foster care and decided that there was a debate there, but of course it's rather like comparing apples with oranges. Have I covered everything? Anybody want to add? Okay, thank you.
Thank you very much, Kevin, for this concise summary. We will move now to Sebastian, who will report on the Roma children in Europe work. Stanislav, I'm very sorry. Apologize.
Hello, good afternoon, everyone. My name is Stanislav Daniel, and I work for the International Step by Step Association, and I'm a coordinator of the Romani Early Years Network. At our workshop, we've heard from two of my friends, Božidar Nikolic from Serbia and Miroslav Sklenka from Slovakia, about their grassroots initiatives to support Romani children by complex set of activities working with the local professionals, parents, paraprofessionals, children. If I look at what makes these two projects somehow similar is the investment in the local capacities, because we've also talked about this as a way for sustainable development, because even if the project, which has the beginning and an end, after it ends, the people and their capacities remain in the communities, as opposed to bringing the expertise from outside and then leaving. Maybe one thing to highlight is that in both projects, 4 municipalities have been addressed and served by a certain set of services and activities, and then the question of sustainability was addressed by the fact that the local initiatives will never be able to solve the issue at a national level or regional level, but there will always be the local NGOs initiative of showing the possible solutions to the problems or to specific issues, and then there is a need of the local government or national government to take over and implement larger scale measures. We've also heard from our colleague Natalia Sophie from Ukraine about the very recent initiative that in which historically for the first time Roma NGOs met state administration and regional administration and talked about the measures that are needed to be implemented. And here I would like to highlight the importance of participation, which was also very important component in the other measures that were presented. And here also we've talked about how important it is that the measures are perceived as successful not only by randomized control trials and other sophisticated measures, but also that it is important that they are perceived as successful and bringing the change by the local community, because their active involvement is again something that can lead to sustainable development. In all of the presented measures and actions, there was some level of involvement of the local administration, but then there was an interesting note made by one of our colleagues, and I'm not sure if I can quote him on that, but Arthur will not be angry about that if I say that even though the municipality is involved, then there is still the invisible elephant in the room, that the municipality signs the memorandum of cooperation, but then they still contribute to human rights violations in the form of not providing access to housing or even to drinking water. So this is something that needs to be addressed. And with my last minute into the report, I would like to conclude by listing few of the conclusions and recommendations that we concluded with in the group. One that was let me just say it. So by all of the individual projects in the ECD, we have created some kind of Roma ECD movement. So we don't want the projects to be perceived individually, but as a part of bigger scheme, the Roma ECD movement, which has been non-existent a decade ago, and we think it is very important to continue in this, even by individual contributions of small grassroots initiatives. Another recommendation is that we the movement, need to create an awareness-raising campaign to send the message clearly across. Because while we work on a number of interesting projects, it is important that the decision makers hear us and get the message. We need to continue improvement of the quality of services. We need to see more intersectorial cooperation, and it is extremely important to stop thinking about early childhood development only within the framework of kindergartens. Thank you very much.
Thank you very much, Stanislav. With this, we'll move now to Andy to report back on Breakout 3 on children with developmental and disabilities.
Thank you. So our group started with a short film about a Prague kindergarten, which I think some of you visited, actually, and about dealing with children with special needs and their aspirations for a greater inclusion environment and opportunity. And then we went on to Mariana, who talked about the work of Karen Dom in Bulgaria. And the interesting lessons from that presentation was that oftentimes government can or funder can provide financing support, but they don't really think things through. So oftentimes what you end up is that you're having maybe a resource for certain parts of the activity, but then nothing that will help sustain it. An example they use is that they did all this training program for support personnel and therapists, but then there was no job security for these individuals, only 3 months. So that kind of disincentivized a lot of the participants. And then Emily talked about another example, similar investment example, using World Bank investment as an example, where oftentimes the money from this founder and bank goes to the local government, and they get to decide how to allocate it. But the challenge is that there's no understanding or agreement within the government in terms of how to really allocate the resources so that you're actually able to deliver the kind of outcome that you need as intended by the funders. So the idea is that you really need to rethink in terms of how to not only use resources, but how do you really structure a process for developing these solutions. We talked about how the definition of early childhood intervention and disability may vary, as was noted in even the presentation, the session, and that there's a need to bring a greater amount of understanding and contextual basis to the activities that are being contemplated. There was a advocacy in the terms of that, perhaps one way we can help people understand the importance of inclusion is that, everyone has some sort of disability in a matter of degree, so that the idea of having greater inclusion will serve the greater public good. Then we had an example from India where we talked about how in a system otherwise not responsive to the needs of special needs children, there was a one school, superintendent who just decided that they need to do some training to better support children with special needs, and which prompted a discussion about the leadership. What does it mean by leadership? And I think there was some consensus that it really is at all levels, but certainly with emphasis on local levels. And that leadership needs to be vertical as well as horizontal, meaning that it needs to go top down, bottom up, but as well as across sector to transfer skills and learnings and lessons. There was some discussion on the cost effectiveness of programs and the importance of evaluation, obviously linked to that, and how many, oftentimes there is no evaluation components to the program that you're implementing. And that all speaks to a few things. One is that the people who are often doing the strategic planning or the national action plan mapping and so on are not familiar or not informed by the reality on the ground that the family often had to deal with. And that there's also no commitment for strategic planning at different levels of government, as well as within the community. There's a emphasis on strategic planning and phased implementation and engagement with as many stakeholders at all levels as possible. And finally, I think the discussion ended on how to really move forward and what would be the recommendations in terms of community who are interested in addressing these challenges. So there was some consensus that the idea of kind of a center-based model in general will not work in terms of reaching all children and families, and they may be able to serve a segment of the population, but certainly will leave many children and families behind. So the recommendation is to think about a community-based capacity building, and the importance of, first of all, is more cost-effective, and the fact that you encourage, along with the strategic planning process, you encourage commitment at all levels. You encourage local ownership of the programs. And then ultimately, what you're interested in doing, you want to empower the family and the local community stakeholders, and you want to invest in them so that they can bridge the gap that is they're currently in the current programs and infrastructure. Did I miss anything? Thank you.
Thank you very much, Andy. And now, last but not least, Janelle will report back on migrants and refugees on the fourth workout group.
Thank you. So our discussion centered around two main themes. One, best practices in integration of services across sectors, and the second around engaging migrants themselves, which really might be subsumed even under best practices, but I'll address that separately. So in regard to best practices, we had a few examples, geographically specific. One from Chile, where there was an example of a baby who had actually died after seeking services and being health services specifically, and being denied services because they weren't registered and didn't have the appropriate registration number, and that led to action on the part of the government to set up offices for registration for unified services across health, education, food, et cetera. And also with that registration system, a better capacity to address issues across stages of life. Within the U.S., some of the positive examples, which perhaps weren't highlighted in the earlier session, were raised in our discussion. One, looking at the Head Start program for migrants in the U.S., as well as the U.S. resettlement program, both of which have contributed to more positive outcomes for migrants within the United States. Then looking at Belgium, it was noted that Belgium is one of the many countries that has signed on to the Convention on the Rights of the Child, but particularly that in Belgium this has been placed above national law. And so it's been agreed that sort of supersedes any national laws that are in place. And so one of the specific ways in which this has benefited migrants is that increased funding for schools which serve migrant populations has come about. And in that process, it was also noted that there was the importance of positive framing for those schools and how to help schools and teachers specifically see this as a positive thing, that the migrant children are actually bringing to the school not only the funding resources from a central source, but also the diversity of experience, et cetera, that can benefit all. And then along that theme of integration, I think it's an interesting parallel to the discussion that Andy just presented, where integration of services is something that can be seen not only good for migrants, but good for all. So across education, social services, social protection, health, et cetera, just as services that are good for children with developmental disabilities or other disabilities are often good for all children. So I think that's just an important sort of parallel theme that came out. And then finally on the best practices theme, it was suggested that this would be an area where this forum could produce a paper on best practices, and that might be an area for action. So then on engaging migrants, some of the examples that were raised were creating young advocates, which Dr. Davis has done with some of the populations she works with in New York City, where young people have been provided with stipends for working as advocates and organizers and have been trained in that area. And they've become very successful voices. Similarly, the Dreamer movement among undocumented youth in the U.S. has been cited as an example for positive ways to engage migrant communities. It was also suggested that perhaps legal cases could be a vehicle through which the voice of migrant populations could be heard, with even children, for example, representing themselves in a legal courtroom as a way to provide a forum for those voices. And then finally, utilizing personal stories. And I think this is a theme that unifies the best practices conversation as well as the engaging migrants theme, is the combination of both data, which we have talked about at the global level, as well as personal stories. And it was raised that there have been several examples, some of whom have been in the room today, of successful migrants, or I'll say people who have immigrated to a country and become very prominent. The example of the founder of Google was given as one example of a person who had come as a refugee and certainly risen to great success. And the importance of highlighting those stories was raised as another important theme.
Thank you very much. Thank you to all the rapporteurs, and I hope I will not simplify too much, but I take the liberty of trying to cluster some of the common themes that came through, at least to me, from the rapporteurs, and excuse me for not detailing everything that you said, but trying to bring it to a higher level. So one thing that I took out from your report is the mention of campaigns, movement, but more specifically, three of you mentioned the need for positive messaging. It also was a strong message in the group that I attended. So I think the importance of bringing this positive output, impact, and stories, and maintaining this as part of the movement is something that was a bit of a thread that I noticed. The second theme that I think all the groups mentioned is the need for community-based local capacity, ownership by the community, and the role for not just top-down but bottom-up. And that came, I think all of you brought this up, the involvement of the community and the voice of the community in all these projects. The third thing, I think, I don't know if to call it governance or maybe just simply multi-stakeholder, multi-sectoral engagement and a joint organization or collaboration between the different sectors, whether they are governments, NGOs, or the community, or within government, the different sectors. So it's intersectoral, multi-sectoral need approaches that are necessary for all the four areas that were discussed. And I think the fourth one is something for the rapporteurs of the final, the report of the final session is to take some of the best practices that were mentioned, like from foster home to stories and so on, and put them as evidence-based, which is what you, Andy, mentioned, and put them as best practices that maybe the forum could take forward in the future. So this is my attempt to cluster some of the discussions of the different groups. So I don't know if we have time for people to add anything, or we need to conclude and break for the day. Liana, please. If not, then Liana should...
This has been a very long and rich day. So we will keep this closing brief so that you can enjoy the evening. First, on behalf of ISA, I would like to say how happy we were to be co-host and to welcome you here in Prague, and also to have participants from all over the world and be in this partnership with the forum, with NAS and Open Society Foundations. I think the topics that were explored today and the presentations we heard really showed how well chosen the theme for the workshop was and how relevant it is in the times that we're living in. And especially now, we see in the world we are so interconnected. What happens in one continent impacts other continents. I think this afternoon really showed that. For me, one conclusion was that perhaps such interconnectivity should be strengthened even more between research, policy, and practice. And hopefully the forum succeeded in bringing these groups together, and that we can have even more learning across the groups beyond the forum. We look forward to the report that will come, and we hope to be able to disseminate it also through your networks as well and through our networks. And also we hope that despite the fact that there was not so much time for discussion, there was a lot of peer learning and sharing nevertheless. I would like to conclude here again to thank all those who presented and all those who attended for your participation during the day.
Okay, and my very last closing remarks are focused on the future, on tomorrow. And I'd like to ground the discussion of the meeting tomorrow a little bit in the very, very first session. In the very, very first session, I mentioned that this event is grounded in rights, and I talked about the rights of children, the rights of migrants, and the rights of ethnic minorities, the rights of people with disabilities. And, you know, I didn't mention the rights of participants to participate. And I think I'm not sure that we respected the rights of the participants to participate and ask all the questions that they had today. And so I think what we would like to do for tomorrow is, tomorrow we have a fantastic opportunity. We have some additional presentations on topics that are very, very relevant to the SDGs, which is how we measure progress in children and what is going on. And we will make sure that there are time for all of you to ask your questions and interact with the presenters tomorrow. So we have a great session tomorrow. It goes from 8:30 to 12. We have, and we invite you all to come back here at 8:30 in the morning. And I think, and there is a dinner tonight that starts at 6:45, and it will go until 8:30, and it will be a presentation of some of the initial findings or the initial things that are emerging from the MEND paper. And I will just have to remind myself of the, it's not written. Mental health and developmental disabilities and delays paper. So that will be presented, some of the initial ideas will be presented and discussed there. So that's another good opportunity if you would like to share your ideas tonight. So thank you for today, and see everybody tonight and again tomorrow.